Has someone you love started showing subtle changes that worry you? Maybe they seem more tired than usual, have lost weight without trying, or seem less engaged in conversations. It's easy to dismiss these signs as just part of aging, but sometimes they mean something more. Many people assume that when the end of life comes, it happens suddenly. But in reality, the body often gives quiet warnings, sometimes months, even a full year before passing. The challenge is that these signs are easy to overlook. They start small, barely noticeable at first, until one day, looking back, you realize the clues were there all along. But you are not powerless in this journey. Recognizing these early signs gives you time to prepare, provide better care, and cherish meaningful moments. It allows you to ensure your loved one's final stage is filled with comfort, dignity, and love. Stay with us until the end, as we walk through 5 important signs that can help you navigate this time with clarity, compassion, and peace. Sign number 1. Significant weight loss. One of the earliest and most telling signs that a loved one may be approaching their final year is unintentional weight loss. At first, it may seem minor, a belt that suddenly needs tightening, clothes that appear looser, or a once hearty appetite that begins to fade. Many families dismiss this as a normal part of aging, but losing weight without trying is rarely a harmless sign. It often indicates that the body is no longer absorbing nutrients efficiently, leading to muscle loss, frailty, and declining strength. As the body begins to slow down, essential systems, such as digestion and metabolism, become less efficient. The ability to break down and absorb nutrients diminishes, making it harder for the body to maintain muscle and store energy. At the same time, appetite naturally decreases. Food may no longer taste the same, and meals that were once enjoyable might seem unappealing. This is not just a matter of preference, it's a physiological change. The body, sensing its transition, no longer sends strong hunger signals to the brain. Beyond normal aging, weight loss can also be linked to underlying health conditions such as chronic illnesses, cancer, kidney disease, heart failure, depression, or even a slowing metabolism. These conditions can contribute to a gradual yet steady decline in body weight, making an individual more vulnerable to weakness, infections, and increased fall risk. If you notice significant weight loss in a loved one, forcing them to eat more may not be the answer. Instead, focus on small, nutrient-dense meals that are easier to digest and require less effort to eat. Hydration is just as important. Offering sips of water, herbal teas, or broths can help maintain energy levels. Consider soft, high-protein foods like yogurt, mashed vegetables, or protein shakes. Most importantly, understand that the goal is comfort, not force-feeding. Providing favorite foods in a relaxed, pressure-free environment can make a difference in their well-being. Recognizing this sign early allows you to offer the best possible care while ensuring your loved one's final months are filled with love, dignity, and peace. Sign number 2, extreme fatigue and weakness. One of the most noticeable and heartbreaking changes in the final year of life is a deep, persistent fatigue that doesn't go away with rest. This isn't just the typical tiredness that comes after a long day, it's an overwhelming exhaustion that makes even the simplest tasks feel impossible. Getting out of bed becomes a challenge, walking across the room requires immense effort, and activities that once felt routine, such as cooking, dressing, or even holding a conversation, become draining and exhausting. This extreme fatigue happens because the body is conserving its remaining energy. As the heart weakens, it struggles to pump blood efficiently, leading to slower circulation and reduced oxygen supply to muscles and organs. Without enough oxygen and nutrients, energy levels plummet, and the body prioritizes only the most essential functions. This is why many elderly individuals in their final months may sleep for long hours, take multiple naps, or even struggle to stay awake for extended periods. Some may experience sudden energy crashes, where they seem fine one moment but completely drained the next. Beyond the physical toll, this extreme weakness has a significant emotional impact. Many seniors who were once independent and active begin to feel frustrated, embarrassed, or even guilty about their declining energy. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply don't have the strength to participate. This can lead to a cycle of isolation, where they stop trying altogether, which only accelerates their decline. For families, watching a loved one go from engaged and active to exhausted and withdrawn can be painful. It's easy to assume they need to push through or try harder, but the kindest thing you can do is allow them to rest without guilt. Make daily tasks easier by offering assistance with mobility, using supportive seating, or adjusting household routines. Most importantly, focus on quality time rather than pressuring them to stay active. A peaceful conversation, a quiet moment together, or simply being present can mean more than any activity. In the end, what truly matters is that they feel loved, understood, and at ease. Sign number 3, cognitive decline and emotional withdrawal. One of the most profound and difficult changes in the final year of life is the decline in cognitive function and emotional withdrawal. A loved one who was once sharp, engaged, and full of conversation may begin to forget familiar names, lose track of time, or struggle to follow conversations. They might repeat themselves, misplace objects more frequently, or seem momentarily confused about their surroundings, even in their own home. These changes can feel sudden, but they are often gradual warning signs that the brain is slowing down as circulation weakens and oxygen supply decreases. In addition to memory loss and confusion, many seniors in their final months begin withdrawing emotionally. It may seem like they've lost interest in talking, engaging in activities, or responding to family interactions. But this withdrawal is not a sign that they don't care, it's a sign that their brain is processing emotions differently. Social interactions, which once felt natural and enjoyable, become overwhelming and exhausting. Conversations may feel too fast or too complex to follow, making them anxious or frustrated. Loud environments may be overstimulating, and even familiar places may start to feel disorienting. For family members, this change can be incredibly painful. It may feel like you're losing them before they're actually gone. But it's important to remember that this withdrawal is not personal, it's simply how their mind is adapting. Instead of trying to bring them back into conversations or correct their memory lapses, the best thing you can do is meet them where they are. Speak gently and patiently, allowing them time to process their thoughts. Keep interactions simple and soothing, rather than overwhelming them with too many questions or fast-paced dialogue. Create a peaceful, familiar environment with soft lighting, calming music, and cherished objects that bring them comfort. If they seem distant or quiet, know that your presence alone can be reassuring. Even when words fade, love, kindness, and a sense of familiarity can still be deeply felt. Your support, patience, and understanding can bring them peace in this final stage of life. Sign number 4, major changes in breathing and circulation. As the body enters its final stage of life, one of the most noticeable changes is a shift in breathing patterns and circulation. This can be one of the most distressing signs for loved ones to witness, but it is a natural part of the process. Breathing may become slow, shallow, or irregular, with pauses between breaths that can last for several seconds. Some individuals may experience gasping or labored breathing, which can seem alarming but is not necessarily painful. It is simply the body adjusting as vital functions begin to slow. One common pattern seen in the final days is Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. In addition to changes in breathing, circulation begins to weaken as the heart prioritizes sending oxygen to essential organs rather than the extremities. This often results in cold hands and feet, a pale or bluish tint to the skin, especially on the fingers, toes, lips, or nose, and mottling, a marbled, purplish appearance on the skin. Fluid buildup in the lungs can also make breathing more difficult, sometimes leading to a gurgling or rattling sound when they inhale. This can be unsettling for families, but it does not necessarily mean they are in distress. During this time, the focus should be on comfort rather than trying to fix these changes. Keep the room cool and peaceful, with soft lighting and minimal noise to promote relaxation. Elevating their pillows or positioning them slightly upright can make breathing easier. Offering small sips of water or swabbing their lips with a damp cloth can help with dryness. Most importantly, provide reassurance with a calm, gentle presence, speaking softly, holding their hand, and simply letting them know they are not alone. These changes can be difficult to witness, but they are a natural part of the body's transition. The greatest gift you can give in this moment is peace, dignity, and unwavering love. Sign number 5, frequent infections and slow healing. As the body nears the final stage of life, the immune system weakens significantly, making elderly individuals far more vulnerable to infections and slower healing. Where once a simple cold or minor scrape would heal quickly, now even the smallest infection can linger or return repeatedly. This decline in immunity often leads to frequent illnesses, such as pneumonia, urinary tract infections, UTIs, chronic colds, and persistent flu-like symptoms. Additionally, cuts, bruises, or pressure sores take longer to heal, leaving the body more susceptible to further complications. One of the most concerning aspects of this immune decline is that antibiotics and other treatments may no longer be as effective. The body's ability to fight infections naturally diminishes, and even with medication, recovery takes longer than it used to. In many cases, infections that once seemed minor can escalate quickly or become recurring issues, requiring stronger medications or multiple rounds of treatment. Over time, the body struggles to respond, and each new infection can further weaken an already fragile system. For families, seeing a loved one battle frequent illnesses and slow healing wounds can be distressing. It's natural to want to seek out aggressive treatments, hoping that another round of antibiotics or a hospital visit will help. However, as the body declines, the focus should shift from curing illnesses to ensuring comfort and quality of life. One of the most important ways to support your loved one is to prioritize comfort and hydration. Encouraging fluids, whether it's water, herbal tea, or broths, can help prevent dehydration and ease symptoms. Recognizing the early signs of infection, such as unusual fatigue, confusion, or sudden weakness, can allow for gentler symptom management before a condition worsens. Keeping the skin moisturized and wounds clean is also essential to reduce the risk of skin breakdown and infection. Rather than focusing solely on medical treatments, the goal should be to create a calm, soothing environment, helping your loved one feel safe, comfortable, and cared for. This approach not only preserves their dignity but also allows you to cherish each moment with them, free from unnecessary suffering. Watching a loved one go through their final stage of life can be one of the most emotionally challenging experiences we face. It's natural to feel helpless, overwhelmed, or even afraid of what's to come. But as difficult as this journey is, it is also an opportunity to offer the greatest gift of all, unwavering love, comfort, and presence. Rather than focusing on the things we cannot change, we can choose to shift our mindset. This stage of life is not just about decline, it is a time to honor their dignity, provide gentle care, and cherish the moments that remain. Whether it's through holding their hand, sharing quiet conversations, playing their favorite music, or simply being present, Every act of kindness brings peace and reassurance in ways that words cannot. You are not alone in this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can bring strength, patience, and peace. By understanding these signs, you are giving yourself the ability to be there for your loved one in the most meaningful way possible. If this video has helped you, we invite you to share your thoughts in the comments below. Have you experienced any of these signs with a loved one? How did you navigate this difficult time? Your story could provide comfort and guidance to others who may be going through something similar. And if you found this content helpful, please consider liking, subscribing, and sharing this video. Your support allows us to continue creating content that informs, uplifts, and empowers families facing life's most tender moments. Remember, this journey is not just about saying goodbye, it's about making every moment meaningful, loving, and peaceful. You are giving a priceless gift by simply being there. Hold on to love, and cherish the time you have together.